without wasting our time, I would like to call on Dr. Mrs. Olurishe to proceed on the lecture. Dr. Mrs. Olurishe, the platform is yours.
Distinguished colleagues from the Department of Pharmacy, University of Ilorin Teaching Hospital. I also want to use this opportunity to welcome my own amiable colleagues from the Department of Pharmaceutical Services here at Amadu Bello University Teaching Hospital, all other professors who have taken time to be part of this meeting, and our colleagues in Department of Pharmacy all over the teaching hospitals and federal medical centers in our nation. We are welcome to this meeting this morning. I am by name Olurishe, and this morning we'll be looking at conducting a publishable research in hospital setting. In other words, it means that we can conduct research in hospitals, but our aim or focus this morning is that we want to conduct this research with the mind of being able to publish the outcome of our research in reputable journals. So just as a form of introduction, we want to look at research in broad view. Now, what is research? Is a systematic and well-structured investigation. It's well thought about. It's not something that is done haphazardly. That is what we mean by is systematic. Is well structured in the sense that it has various elements, it has sections, and each of these sections and elements have to be well executed for us to be able to bring out a research that indeed can be publishable. Now, a research is aimed at finding out new facts on a subject matter. What do we mean by this? Every outcome of a research work is supposed to have an aim at contributing to knowledge. In other words, I am looking at a specific subject matter, but I am not the authority in that subject matter. Some one or two persons have looked at areas in that particular subject matter. I am conducting a research with the aim of adding my own information, my own outcome of research. I want to bring out new facts. I want to be able to contribute on the subject matter, either that is already well established, or even if it is not well established, if it is a novel area, I want to bring out new information as a form of contribution to the scientific world on that issue. It is harnessed with existing information. Just like I said, there is already knowledge on ground concerning this area that I want to look into. And that is where the literature search is very important. What is the existing information in this particular subject area I am trying to look into? What is already on ground? I have to bring it to fore. And that is where you are able to justify your own statement of research, because I'm harnessing it with information that is already existing. I'm not just walking alone as if I am trying to do something by myself. There's already an information on ground, and I must harness this existing information with my own work. Now, we are also able to, at the end of any research, draw reasonable conclusion. I have a subject matter, I have an aim, and at the end of the day, what am I concluding? What am I bringing to table as the final statement of the research work that I have just carried out? Now, we're looking at the purpose of research. Remember that we said at the beginning that we are looking at publishable research in hospital setting. But why research at all in the first place? One, it is to be able to increase knowledge within the discipline. We talked about harnessing with existing information, but at the same time, I have brought in something new, a new fact that I want to use to increase knowledge within that particular area in my own discipline. I also want to be able to improve the quality of service and impact patients and also health system policies. We are in the hospital, and hospitals are established purposely to take care of the needs, healthcare needs of patients. So if I'm carrying out a research in the hospital setting, one of the first things I should have at the back of my mind is the outcome of this research. Is it impacting patients? Is it improving their quality of life? And then what about the quality of the service we are rendering as pharmacists in our department? Is it going to help us improve on our quality of service? The third point, to increase the knowledge within oneself as a professional consumer of the outcome of research, in order to be able to evaluate and understand new developments within the discipline. These are just parts of the reason why we want to conduct research in a hospital setting. Purpose of research continue. Clinical pharmacists are now involved in research directly as principal investigators. You know, when you are carrying out research in hospital setting, before now, the doctors are seen to be the ones spearheading or heading research team. Part of the mission of any hospital, in addition to providing service for patients, is also to train staff and also to conduct research. But our medical colleagues have been the ones heading research teams. But now clinical pharmacists are now being involved directly. When we say principal investigator, it means you are the one heading that research team. You are the one that is in charge. You are the one dictating the pace. You are the principal investigator. And clinical pharmacists are beginning to do that. In my own hospital, we are beginning to do that. And I believe that this is also happening in a number of other tertiary healthcare facilities. That's why we are looking at conducting a publishable research. Research has shown that in Western climes like Canada, up to 75% of the pharmacists have been involved in research within the most recent 5 years. And this is a call to us. I don't know whether we have up to 75% of our hospital pharmacists in Nigeria being involved in research, but it's a clarion call to us because things are changing. We need to come out. We need to make our profession be known, not just at the back of cubicles. We need to be able to showcase ourselves also, that we can not only be principal investigators, we can have research units as part of our units in our various departments. The scope of hospital research. Now we're talking about research in hospital setting. It's not only limited to conducting research in our own department. It's not only limited to research that concerns drugs. Hospital research is broad, but as pharmacists, most times we find ourselves limiting to research that concerns having to have drug involvement or therapy or management. But hospital research is broad. It could mean a lot to us if we look at the scope of hospital research and not just limit ourselves to therapy or management. Now it can assist in validation of current practices, like evaluation of management of some disease conditions. For example, we know that, thank God, the COVID-19 is beginning to become a thing of the past, we believe. But for example, that is what is the in thing right now. Pharmacists should be involved in evaluation of management of disease conditions, especially emerging and re-emerging infections, and for novel infections like the COVID-19. In my own facility, we are already involved as part of researchers evaluating the management of COVID-19. We can also be involved in the evaluation of possible improvements in current practices. This is our own domain, for example, drug utilization studies. I know that quite a number of pharmacists are involved in drug utilization studies. What we used to know before now, and I know that we are very comfortable and conversant with, now we are looking at the needs and benefits of improving research in pharmaceutical services. Number one, it improves the patient outcomes and quality of life. Encouragement of multidisciplinary teamwork and pharmacist integration, proper integration into the healthcare setting. Also improving the knowledge, scope, and visibility of services offered. In addition to improving the visibility of our services in our own local settings, when we carry out research and this research is published, the wider world, the wider scientific world is able to view and see what we are doing in our own local setting, and it's, at the end of the day, improves our professional image as pharmacists. Sorry? Can you hear me, please?
Yes, we can hear you. We can hear you.
My screen is not going down.
Okay, it's more.
Okay, sorry, there's a lot of interruptions going on here. Importance and outcome of research. Like I said, any hospital that is established for the purpose of taking care of patients. So patients are the primary beneficiaries of the outcome of our research work. The system benefits also, like in savings, the ego of the establishment is enhanced due to improved healthcare delivery, which is consequent to research findings, and it also enhances professional competence. Now, what are the opportunities for research in the clinical setting for us as pharmacists? We can actually be involved in human studies. Human studies in the sense that we use patients directly for our research work. This could be retrospective in the form of using the patient's clinical data, using their folders. It could also be prospective. It could be ongoing, where you are carrying out probably focus group discussions, you are carrying out intervention studies, and it's ongoing. You are using the patients for a period of time, maybe 3 months or 6 months. We can also be involved in clinical trials. In fact, for majority of large population studies in hospital settings, most pharmaceutical companies sponsoring those research will insist that a pharmacist be on board, because they want you not only to be in charge of dispensing the medications, they are very sure that you are the one that can put the drug in the proper storage condition and environment. So pharmacists also have the opportunities to be involved in clinical trials. Like in my own facility presently, we are involved in a clinical trial, and pharmacists are involved also as co-investigators in that research. The evaluation of new and existing pharmacy programs and services. There are also opportunities for us. You have something already going on in your facility, in your departments. You can carry out research to evaluate whether you still need to operate in that manner, or whether the outcome of the research will dictate a new pace for you to operate as a department. Other opportunities also include investigator-initiated prospective observational and intervention studies. Like I mentioned, intervention studies like pharmaceutical care, medication therapy management, they are ongoing studies. What are the hindrances to pharmacy research? The first one is the lack of system interest. I'll say this before the pharmacist interest. Now, when we're talking about research, like I said, benefits of research. Any research that is not going to bring about financial upliftment for establishments, for example, most of them are not interested. them to come into a research, you want them to sponsor it. They are not interested because they are looking at the outcome. How is it going to benefit us as an institution financially? Most managers are not looking at how it wants to benefit the patients. They are interested in how it wants to benefit their system financially. And then we, the pharmacists ourselves, our interest in pharmacy research. And the reason for this actually is because in the hospital setting, we are not promoted based on our involvement in research work. Our promotion is based on length of stay of offering service. Every 3 years, you are promoted, having passed an interview. If they do one in your own institution, you are promoted to the next rank. So this publication doesn't affect your career progression in the hospital as it does in the university settings where our other pharmacy colleagues in academics work. So we do not have the interest in research. We do not see how it's benefiting us, but meanwhile, it really promotes our image as a profession. It helps our services to be more visible. It integrates us better in the healthcare setting. Another hindrance here is that research is time consuming. It requires skills, and these skills are not taught in our various schools of pharmacy. The best you actually do is the research you carry out as a project in 500 level graduating class. So the basic tenets of research is not taught unless you register for a postgraduate program, you do masters or PhD, and then you begin to look at research methodology, you begin to look at statistics. Otherwise, it's not something we are taught in school. And it's with the B.Pharm I have been given a job in the hospital setting. And so I don't have that foundation. So the interest coupled with not having the required skill is a serious problem for pharmacists in the hospital care setting when it comes to research. Even with our colleagues that are in the developed nation, is something that is just coming up. I mentioned Canada, and if you can remember the statistics I gave, I said 75%, and that is just in the last 5 years. So it's something that is a global problem, not only for us in Nigeria as a nation, but we can always start from somewhere. It has been suggested that participation in research be a consideration in salary increase in promotion. Well, that is not within our own scope to determine as the hospital pharmacist. It's a ministry issue. You know, we are under the Federal Ministry of Health. It's something that is gazetted, how we are promoted in the hospital care setting. But maybe using the suggestion of TISDAL, if what obtains in the academic setting is actually what we will start looking into, then maybe it might arouse our interest as pharmacists in the hospital to carry out research. Other hindrances, we're looking at these hindrances because when you know a problem, then looking for solution to the problem becomes easy. So these are the hindrances, the things that have before now obstructed us. But sincerely, there are things that we can overcome, there are things that we can carefully with time begin to surmount. Another very important one is inability to access patient data. Because of the struggle for supremacy in the healthcare setting by our own medical colleagues, I know that a number of hospitals, at least from the experience of our FPCPharm, when other tertiary healthcare facilities were talking about they are not being given access to the wards. Pharmacists don't have access to go to the wards. They don't have access to patient data. You are just logged in your own cubicles, dispensing medications, compounding. In my own facility, by the grace of God, it's not a problem for us. We have even our unit dose dispensing system pharmacies right inside the wards, where the pharmacists are involved in pharmaceutical care services for the patients. And this cannot be done unless you have access to the patient's folders, where you can take information apart from you establishing a relationship with the patient and collecting data. There are some important information you need to collect from the patient folders, which other healthcare professionals like the doctors and nurses have documented in the course of carrying out their own care service. So this is very important. A number of hospitals still don't allow pharmacists access to patient data. And so if you're talking about research where you want to do a prospective research, you need to go back. I do not know how you are going to be able to do that when you do not have access to patient data. But with time, I believe, and with a good rapport and relationship, we all have our distinct duties. That is what I want us as pharmacists to recognize. We have our distinct duties. We are not trying to rub shoulders. We are not trying to take over anybody's work. It's not a do or die affair. It's not a battle. I discovered that many times the pharmacist, in the name of trying to access patient data, you are struggling with the medics, and they will always show supremacy. They want to tell you that, look, in fact, I witnessed the situation where a doctor told me point blank, Madam, you want to take what I have written down to go and publish, that he is the one that has this information. He wrote it here himself. Why am I coming to take it from the patient data? But that's not the issue. It's not only that I want to publish data. I'm interested in improving outcomes of management in this patient. I'm interested in improving the patient's quality of life. We need to let the medics understand what we are doing when it comes to research. We are not just trying to improve our own image. We are here together with them to better the condition of service of our own establishment and improve outcomes in patients. So this is a problem we really need to look at, and by the grace of God, surmount as time goes on. The other one is lack of requisite knowledge, experience, and confidence on the part of pharmacists. Now, I'm looking at this confidence issue as an offshoot of not having the required skills I spoke about in the last two slides. Because when you have knowledge, it becomes a booster for you. When you have knowledge, you have confidence. Quite a number of our hospital pharmacy colleagues have not been engaged in further PG programs to enhance our professional competence and knowledge. So even when you bring a research idea to them, or you want them to collaborate with other healthcare professionals in carrying out research work, the confidence is not there. It's like, what do I want to say? What do I want to bring to fore? If they start asking me questions on this now, what do I say? All these are problems. But I think we should encourage ourselves as colleagues within our own various healthcare facilities. Let us encourage one another to take up PG programs, because this knowledge and skills we are talking about, you cannot acquire them when you are inside your cubicles, locked up, dispensing medications. And right now, the internet has made the world a global village. You can get knowledge, skills, a lot of information. We can get ourselves educated, as we are doing right now, by linking up on special programs. There are programs, PG programs you can do as a candidate right here, and there are programs abroad. But I know that those ones actually also need quite a number of funds. But what are we emphasizing here? We need to boost our confidence by getting the appropriate skills and knowledge that is required for us to integrate ourselves as part of the research that is going on in our various healthcare settings. Now, pharmacist-led research as an element of health service research. Health service research is usually multidisciplinary. That's why I mentioned that right now there's a clinical trial going on in our own facility. And I remember all I had to go through to be part of the research, go through in the sense that all I had to submit to the international body that is sponsoring this research for them to have us as a department be part of the investigators for their research. But the issue is that the medics did not allow us to rest, because they have been told that unless pharmacists come into this research, then the research wouldn't start in our own facility. In other words, it is multidisciplinary. Everybody has a part to play. We are all involved, and we must see that we should be part of these elements of our health service research. Pharmacist-led health service research is essential to improvement of service delivery, and it leads to necessary changes in policy direction. Data-driven empirical evidence is needed to convince health policy management. I'll give an example of this. I wanted a medication therapy management clinic established in our own facility. Medication therapy management is a pharmacist-led intervention service. But how am I going to convince the management to establish a clinic that pharmacists will be in charge of? It's basically to manage therapies. What I had to do was, first of all, get ethical approval to conduct a pilot MTN clinic. And what I wanted to do was to be able to generate data. And what's the purpose of this data? To convince the management, look, what I'm talking about, I have conducted a pilot study. These are the outcomes of the research from the pilot medication therapy clinic that we're conducting, and providing such evidence before them. Most times, if you have something to bring to the table, it helps you to convince managers, and then they can direct health policies towards favoring whatever it is that you are asking for. Now we are done with the introduction. We want to look at the research landscape. What is going to enable us to put up a research work that will be publishable? Remember conducting a publishable research. I believe before now, at least we have conducted some 1 or 2 projects in our different facilities. But we want to look at the elements that will make this research work publishable. So what's the research landscape? We have a pre-execution stage of any research. Remember at the beginning, we said research is what? Is not something that is haphazard. It's not something that you just wake up and you begin to do. Research is organized. The pre-execution phase requires the elements you need to put together before you start the research work, which is the execution stage. And having executed the research, what about the post-execution, your data analysis, your write-up? So briefly, we are going to look at the research landscape starting from the pre-execution stage. The first here is conceptualization and then your proposal. For you to carry out any research, you must have a concept in mind. There is a problem on ground, and we need to be able to identify what this exact problem is. Every research aims to provide a solution. There's a problem on ground. I want to profile a solution. How can I profile a solution? I need to carry out a research work. And this research must contain these various elements for me to be able to eventually either profile a solution or suggest recommendations for the problem that has been identified. Another important stage of the pre-execution phase is ethical approval. We are working in hospital and patients are involved, records are involved. The records of our patients are supposed to be held in confidence. In fact, if you look at their folders, they will tell you confidential information. It shouldn't go out of the records. It shouldn't get out of the doctor's consulting room. Why? Because we are dealing with human beings here. And for anybody to consent to your research, you will need ethical approval. I believe every hospital has its own ethical management committee. We have in our own facility, you have to apply when you want to carry out a research work. You apply to the ethics committee and they will give you a form. We fill a form in our own facility. It involves a lot of things. Once you have gotten your ethical approval, you also need your patient's consent if you are carrying out human studies. Attached to every ethical approval form is a consent form also that the patient will need to fill. Because even when you want to publish the eventual outcomes of your research, a number of journals will tell you to attach your ethical approval or indicate the number of the ethical approval. So it's not only for the purpose of carrying out the research, for it to be publishable, reputable journals will require your ethical approval. All these are very important for a pre-execution stage. Now, looking at the concepts and proposal, it may focus on any of the elements of the medication use process. We know the medication use process, we know that circle. When we are talking about our concepts, it can be on any of the medication use process. It may address important questions that facilitate improved patient care of our service delivery. We also have medical record reviews, like I talked about, the patient's folders, prescription patterns, which I believe we are all used to, evaluating management of certain disease conditions, like I said, whether they are emerging conditions, whether they are re-emerging, whether they are prevalent conditions in our own setting, efficacy and safety studies, clinical trials, all these are concepts that we can look into when it comes to hospital research. Pharmacists as investigator-initiated prospective, observational, or interventional studies. I have mentioned having to conduct a pilot MTN clinic in our own facility. These are pharmacist-led initiated prospective studies, medication stability, compatibility studies, even comparative studies. They can be pharmacist-led. There are concepts we can have. There are various areas of research we can look into as pharmacists. Now, the research loop. We talked about the statement of research problem as part of the stage in the pre-execution phase. Clearly define the research question. That is the statement of research problem. There is a problem on ground. You have to define that problem. You have to clearly state it. And when we are looking at research, it means that having stated this problem, and I want to look into it, it should be something that can be evaluated with 2 or more variables that can be measurable. So when we identify a problem, we have an aim for our research. We now look at the specific objectives that we want to achieve. When you look at the specific objectives, they are ingredients that enable you answer your research question, or as it were, enable you achieve your aim of conducting the research. Now here we are saying that our specific objectives must be specific, that's for S. It must be measurable, it must be achievable, it must be reliable, the method we want to use, and it must be time-bound. This is an acronym that is very common. I'm sure we understand what all this means, so I don't take too much time into that. Then the population or sample should be defined. We should have a target. Like there was a time I wanted to look at drug utilization, and I saw that it was becoming too broad. So I had to tailor my drug utilization to a specific population, and that's diabetic patients. So when you tailor and you target a specific population, sometimes it actually helps to ease and clearly defines your specific objectives for you. Now, this is a model as a guide for study design. We are still looking at our pre-execution stage as a guide for study design. It's an acronym, and this is what it actually means. The P stands for the population of patients with eligibility criteria and sample size. We'll briefly look at sample size later. Eligibility criteria. When you are carrying out a research, like I mentioned, I had to use diabetic patients, but will I now use all diabetic patients? Even amongst diabetic population, I should have patients that are eligible for my study. I can use age as a criteria, maybe diabetic patients 40 years and above. I can use patients with other comorbid conditions, maybe diabetic patients that have other comorbid conditions and are not just diabetic. We need to have eligibility criteria. Sometimes you carry out some studies, the sampling has involved a wide population that at the end of the day, when you are trying to put your data and analyze your data, you begin to run into trouble because you have involved so many people that were not needed and you have also wasted time. The I stands for the intervention that is intended. Now, these are particularly, for example, when you are carrying out human studies. You have to state it out, one after the other. What are the interventions I'm intending for this particular research or study I'm carrying out? For example, one can be, I want to be able to identify drug therapy problems in the patients and then counsel on those drug therapy problems. That's an intervention, for example. Now, I want to be able to educate patients on self-care procedures for their particular disease management. That can be an intervention I'm also intending. But if I don't state it out categorically at the beginning of the study, then I will see that probably midway, I'm already done with maybe 10 or 20 patients, and I have not done this, I have not done that. And that is why we also talk about carrying out a pilot, for example, or testing your questionnaires, whatever interventions that are intended in a study. Carry out an initial pilot where you go out and test for maybe about 5 to 10 patients having obtained your ethical approval. When you carry out this initial pilot, you will discover that there are 1 or 2 points I have missed out. There are 1 or 2 important details I have not included. And some of them are actually gotten when you are interviewing the patients or when the research is ongoing. So you go and incorporate this back into your research so that by the time you start the real execution phase of your research work, all the nitty-gritties that are required will have been well put together. Then comparisons needed is also very important. Sometimes we carry out research and really we need controls for some research. Sometimes the patient can be the control for a before and an after study. Sometimes you need another set of patients to use as controls. Even though ethically, personally, I fight with ideas like this because if you are carrying out an intervention study, it means you have a group of patients and you didn't carry out the intervention studies. What did they do to you? You have another group you have put together and you identify the problem and you carried out the intervention and then you begin to compare to see whether your intervention worked out more in this group of patients than the other. But what's the important point here? If we need to make comparisons in our study, whether within the patients or having to take other group as controls, there are things that should be well spelled out from the beginning. Now, the outcomes to be measured or improved, also very important. You know, when it comes to PCK studies, we talk about clinical outcomes, we talk about humanistic outcomes, economic outcomes. What are these outcomes that you want to measure? You are carrying out a study on diabetic patients. Sorry, I keep using diabetic patients, it's a bias. You are carrying out a study on diabetic patients. You need to know that at the end of this study, I want these outcomes specified. Their blood glucose, their BMI, their blood pressure, cholesterol level, all these outcomes that I want to measure, or I now want to give therapy, medication, and I want to see them improve, you must have them also itemized so that at the end of the day, you don't carry out the study. 3 or 4 patients have gone. You've taken fasting, you've not taken 2 hours. Or you've taken 2 hours, you forgot to take blood pressure. So once these outcomes to be measured are also specified as a guide for a study design, because sometimes, you remember we're talking about publishable research work. Some articles are rejected by journals. Why? Because they have looked at your study design and it's not okay. And these are part of the elements that they have looked at and they have found that the research is wanting in one way or the other because this PICO model has not been put in place. Sample size determination. We want to carry out a research. You cannot use your whole population. You must take a sample. And when you take a sample, you have to use a sample that the results should be extrapolated to the larger population because you could not use the whole population. So it is important to have adequate sample size so that there can be means of having the adequate statistical analysis and inferences. The whole objective of the research is to be able to make projections from the sample to the infinite population. So the sample size has to be adequate. For research, including epidemiological and descriptive or qualitative clinical studies, this is an example of the sample size formula we can use to determine our sample size. Now, I'm just going to explain what the alphabets here mean. N is equals to 1.96 squared times P into P minus 1, all divided by the square. 1.96 represents a factor. When we select 95% confidence interval, and is the most commonly used, but you are free to use between 95 to 99% confidence interval, but most times the common one is to use 95%. That is what the 1.96 represents. P represents an expected proportion in the population or prevalence of that particular disease. For example, you are using humans for your study. What is the prevalence of that condition in that population that you are looking at? Somebody will tell me that I have looked at other literature, I have browsed, I cannot see any study where they have talked about the prevalence of that disease condition. So how do I get prevalence to calculate my sample size? It means that you probably have to start your study by looking at the prevalence of that condition in that particular environment for you to be able to get your P. The D represents absolute error to be set by the research, but this may vary if the prevalence is actually smaller. Currently, there are softwares like G-Power calculator is on the net, is free. You can use it to calculate your sample size. Once you are able to provide the necessary inputs, you know the statistical tool you want to use, you know your variables, you can input this into the G-Power calculator to calculate your sample size. Now we are done with the pre-execution level. We want to look at the execution level or the execution phase. We have talked about subjects. We have talked about questionnaires. Subjects for the execution level. Who are the people for this research work? Who are the subjects that I want to use? The recruitment of the subjects. Am I going to use questionnaires? I've talked about having to test our questionnaires. Are we going to have a focus group discussion? Is the research an outcome-based study? I think we have talked about this. Now, during the research, the data collection, it's very important. Are we carrying out a direct observation? Are we using the folders of patients to collect data? Are we asking patients, for example, to self-report their blood glucose, fasting blood glucose, as the case may be? Are we looking at a prospective or retrospective study? I have discussed this along the line when we're looking at the pre-execution phase. Are we using questionnaires, for example, patient satisfaction studies? Sometimes you want to know how satisfied patients are with your services in your own department, or maybe the services being offered by the hospital at large. You want to look at knowledge, attitude, and the practice of anything as it's were. You want to look at self-care, for example, which I did some times ago. All those ones require questionnaire. But what are we seeing here? Your data collection is very, very important. Which tool are you using for your data collection? Your methodology. All these things have to be put in place so that you don't begin a study midway and you start having to change one or two things. These are the things that reputable journals will look at before they accept your publication. The post-execution elements, the analysis of your data, the statistical tools. Sometimes they're even wrong. We have used a wrong one. And that's why I mentioned the importance of having added knowledge and skills with respect to how research can be conducted. Statistical analysis is a different ball game. Majority of us are really deficits in this area. And you need to be able to analyze your results. You need to be able to interpret the data that you have put together. You need to be able to make inference from your results. You need to analyze it. What tool are you using? These tools are spelled out from the beginning of your study, but the analysis is a different ballgame. Most times, some of us use contractors, statistics contractors. You just go and download your data to them, and they collect some 20 to 30K from you, and they give you a lowdown of data, and you begin to look for exactly what am I to do with this myriad of information, because you don't even understand what the statistician, in quotes, has done. So it's an area we need to look into. But like I said, knowledge, skills can be acquired anytime, any day. It's just knowing the appropriate sources to get such information from. Then, having analyzed your data, the reporting, to report your work. I have here that writing is a skill and is also an art. It's something you have to grow in, you develop. It's not automatic. It's not your first article that is necessarily going to be accepted. So let's not be discouraged, because you need to also see how other people write. You need to look at those various elements that you need to report. You need to know how to conjecture your information together. Majority of us have problem with introduction. You want to introduce the subject matter. Some of us have problems with discussion. Now look at my results, everything I've put together to discuss becomes a problem. What am I to discuss here? Somebody says, is it not clear? This is the result, this is the report, is it not clear? You expect the audience to deduce whatever they want from the results that you have put together. But we should be able to discuss our work. Then the publication itself on its own, which is the reason why we are having this presentation this morning. The publication itself, we'll get to that. Literature search. Even when we wrote our project as 500 level students, we have, is it chapter 2? They call it literature review. You are looking at the subject matter, you are not an authority. One or two persons have looked at it, they have information that they have already published concerning it. You need to be able to search the literature. In fact, I discovered that most times when you are searching literature, it even helps you to discover areas that you can also further look into. You already have your study design. But when you look at literature and you search and you see what other people have done, oh, it means I can include this in mine. Oh, it means this study I'm doing, it means I can even include this particular part. It opens our mind. Literature search, like I said, the whole world has become a global village. It's very easy. In the days of our lecturers, the professors, the over 60, 70 years, it wasn't easy for them to search literature. They go to the library, they are there struggling, they are looking for relevant materials. But in our own case, it has become very simple. We have databases available to us where we can get information at our fingertips. What we only suffer as a nation, well, in some specific area, is just maybe network. Everybody tells you no network. But once you have the databases are available, have some I listed here, you can go and search, because you do not need to waste time. There are resources available, pinpointed. You just need to know the specific search buttons, search words you need to use. And then you put your PICO as a guide for your study design. Sometimes you want to look at an area, you are already set. But because you have not searched literature, by the time you now begin to search, you will see that everything I am thinking of doing has been done. In fact, it was done last month and is already published. So this information that to me is new, I want to quickly bring to fore. Somebody just did 2 months ago, 3 months ago, 6 months ago. So we need an extensive literature search, not just to help us in harnessing what we have with existing information, but also to let us know the areas that others have looked into so that we don't have overlaps or duplicate research findings. Familiarity with statistical test tools, there are quite a number. It's not something funny to have to learn all this, but in the walls of the academic setting, these are things that we can actually trash. Now, a rough cut on implication of findings. A good understanding of the specific implication of the findings based on statistical inference is important. Note any limitation before arriving at critical conclusions. Unexpected outcomes outside the norm, even with controls, should be looked into critically. Statistical analysis. I have discussed this, is an important element of making sense of research. It should be determined from the onset of the study. The nature of the data has to be known to determine the tools. Whether it's categorical data, whether it's non-categorical data, it is very important for us to have all this in mind for us to determine the particular statistical tool that we are going to use. Now, making known the research outputs. What is the essence of scientific communication? Effective communication is an essential part of the scientific endeavor. Even the most brilliant scientific discovery, if not communicated widely and accurately, is of very little value. Knowledge that is not shared is as good as not known. Communication of findings of research sends the benefits to the larger population for the benefits of mankind. Do you know that it was when I was a student, PG student, that I discovered that the textbooks that we read actually are just an agglomeration of research findings of various individuals. The people that write the textbooks just come together as author or as editors. They pick findings, research outcomes, recommendations from smaller research that have been conducted, and they put together and they give you one big textbook. It is because these people have communicated their research findings. That is why others are able to put them together to give us the textbook as a tertiary source of information that we actually read. It's also a reflection of intellectual and professional capacity of the system. What are our publication essentials? Ethics in publication, plagiarism, originality and relevance of research output. It must be original. You are not just going to bring someone else's work, someone else's recommendation, someone else's finding. You must be bringing something new to table. Avoidance of simple replication, or you keep validating other people's studies. Once you have finished, your discussion is all to validate this person's finding. This particular outcome I have seen validates this. This one validates this. At the end of the day, your conclusion is just to validate what others have done. What is it that is new that you have brought in addition to validating? Fine, you can validate one or two other findings. But what's new that you have brought to table? What's your own original information? Preliminary research work. Pilot aspect of main studies in several instances. Now, what's your target audience? Is it close? Is it wide? We're looking at publication essentials. Collaboration increases quality and publication potential. That's why I said that the larger bodies, international bodies that sponsor research, they see to it that almost every healthcare professional is involved in the study. Sometimes even patient relatives or caregivers, as we call them. So when you collaborate, it also increases the potential of the research work to be published. Multi-center studies and possible international partnerships, very important. Now, we looked at plagiarism. Let me quickly just talk about this plagiarism. It's the act of using another person's words or idea without giving credit to that person. You just go and quote. We say you are doing literature review. We are discussing our work. You just go and quote people's work. You don't give credit to them. Most reputable journals, we do what we call a plague check. They will subject your article to a plague check and see areas where you have simply duplicated people's findings, you have duplicated outcomes of people's research, and you have not given credit to them. And even the area of duplication, it has limits. You cannot just be writing literature review and you just use people's words, people's language. You use exactly how they have put it. Everything is just in quotes, in quotes, in quotes, in quotes. They will reject such publication. So it's something that is very important. Let your work be original. And if you have to quote people or reference people, do not let 50% of your work just be quoting other people's information or results of their investigation. In fact, the word is actually like a thief. You're literally thief. You are kidnapped from someone else's work. Reputable journals will not publish that. Elements of publication. This is what you must follow: introduction, materials and methods, result, discussion, and conclusion. Like I said, writing is science, is an art, and is a skill. All these various elements, you need to put them together adequately for the journal. They have what we call instruction to authors. There are ways in which some particular journals want you to structure this, and you have to follow it for your article to be accepted. Now, just to look at examples of some clinical pharmacy focused journal. This is one, International Journal of Research and Development in Pharmacy. This is another one, Research and Review, Journals of Hospital and Clinical Pharmacy. This is just to tell us that we have journals where we can publish our work, hospital-based research work. We can look for journals that target the outcome of the kind of things that we are publishing, our findings. Now, just to look at our own experience here as a department in A.B.U.T.H. These are the areas of research we have carried out in time past and we are still looking into. Our intern pharmacists, when they come to do internship with us, they carry out research work before they are issued their certificate of experience. It's mandatory that they carry out a research work which is well written using the elements that we just discussed. Now, fellowship and postgraduate projects. We also have our colleagues that are part of the college, the West African Postgraduate College of Pharmacists. We have MSc students. We carry out research in collaboration with the faculty. They send students to us and we carry out research together with the students. We have our own departmental operational research, which we have divided into various teams, and we also collaborate with other healthcare professionals. Now, there are pharmacist-led research from other nations. Just to show some example, when I say pharmacist-led research, it means you are the principal investigator. You are the initiator of the research. It's your concept. We have our colleagues doing it elsewhere, and I know quite a number of us are also involved in it, is to be able to bring it to fore and also publish our own research. Now, what's the way forward and what's the suggestion? Advocacy for funding from various management of hospitals and industry, hospital collaboration is very important because we have looked at the hindrances, the problems that we are having as hospital pharmacists that is not enabling us carry out publishable research work. We can collaborate with industries. They can help us. We can begin to look at some efficacy studies of their medication. We can publish such things. We need an enabling environment for pharmacists to assess patient data and adequate integration into healthcare team. Increasing the participation of hospital pharmacists with recognition programs of specialization and clinical career structure. I think the college is critically looking into this. They've been doing that for some years now. We just pray that whatever still needs to be put in place for this to become something that is gazetted and standing will soon be put in place. The staffing and establishment of research and statistics units, training units. It can also help us in our various departments, in our healthcare facilities. Let's have research and statistics units You have somebody there, you have somebody heading it. The person comes to work and knows that I have to bring out something. I have a report to give. I have colleagues to say something to. If you establish such a unit, it can also help us. Then even our own association of hospital and administrative pharmacists can develop mentored research training programs. Let's encourage one another. Let's have mentored research, operational researches that we carry out. These are the things we should be presenting when we are having our conferences. In the USA, the National Association of Board of Pharmacy, they include drug and drug-related research in their definition of the practice of pharmacy. In other words, to carry out drug-related research is part of the definition, part of what entails being a hospital pharmacist. And I think we can also adopt that. The Council on Credentialing of Pharmacy lists participating in research activity as a domain in pharmacy practice. That is also from the USA. These are my references, and thanks so much for your attention.
Can we give a loud applause? Thank you very much for the wonderful, educative, impactful lecture that you are giving us today. We all agree with me that it was an interesting lecture so far, and we have all gained one way or the other. Without wasting our time, I would also like to recognize the fellows of West African Postgraduate College of Pharmacists, as well as the fellows of PSN who are on the platform. Also recognize the Director of Pharmaceutical Services of various institutions who has been part of us, and so various researchers in different institutions too. I recognize your presence. Thank you very much. Our lecturer, as a recap, just a few recaps on what we have done so far. She defined what research is actually is, that is West structural systemic work, uh, sectional and sections, and she also talked about the aim, that is contributing to the knowledge and harnessing what the existing information. She talked about drawing conclusions, at least from your investigations, at least the research you have done. Uh, the it also talk about the purpose of this research, that is, it increases the knowledge base, it also increase the quality of service, and of course, the patient is the real beneficiary of our research and development. The She talked about so many things, and I believe we all gained from what she said. She talked about the scope of research, that is, hospital research is broad, and you have to tailor it towards the area where you actually want to work, and so that to make much impact and benefit to the profession. The needs and benefits are enormous. She talked about the proper integrations, increases the knowledge and feasibility of our services as a professional. It also talk about the professional, improving the professional image. Of course, hindrances to the research fund is one of them, which she talked about. The data accessibility, which many of us have issues with in our various institutions, and thank God she talked about how we can get over it based on our own personal experience. Of course, the landscape, she took us to the mainstream of research, how we can conduct research from the scratch, that is the pre-execution, the execution, and post-execution, and to the point of giving us the clue on how we can get our sample size and the various formula we can use to do that. In writing for publications, that is the literature review, in terms of execution, the literature review, and the various publications we can actually check to do this publication. In Hall, she especially talk about the plagiarism, which is very, very important in defining the quality of our publication. That is, as a professional, we shouldn't be finding a web of plagiarism. And she defined what plagiarism is all about, and she also talked about ways we can afford it as it is. We once again, I thank our doctor for the wonderful lecture she has given us. And in our usual practice, we are going to have another 20 minutes to ask questions. I can see some people have been posting questions to ask questions. To ask questions, and when you we have that, then later we can, if you have anything to say, we unmute you so that you can also say it as well. But as we are going, we'll continue to harvest the question.
Let us stop sharing this. Let us stop sharing this.
Okay. Dr. Ma, Doctor,
Yes.
please, can you stop sharing the screen? So that
Okay.
thank you very much, Ma. So the floor is open for your various questions, and as time goes on, we shall be harvesting various questions. I think
Dr. Medubi,
Dr. Mrs. Medubi, I can see you raising your hand.
Come on, Mr. Self. Go ahead.
Wonderful. Everyone, I want to thank the presenter for the wonderful presentation. However, I have some questions and comments. My first question is on sample size and formula. Yes, in case if the prevalence is not available for the study that one wanted to conduct, what should the person do? Then secondly, the formula too may not really be applicable to comparative studies. And I want her to say whether the formula is can still be used for comparative studies, or also for patients that have greater than 10,000 or less than 10,000. Then concerning the analysis contractors, the statisticians, actually they are good, because one may not really have the time to sit with to do the analysis by yourself, but you have knowledge. I think it is the person's work actually, and the person knows what he or she wants to do. So the person needs to sit with the statistician. That's my advice. You need to go there and sit with the statistician, comes with your work, and you know what you want. So now design the template for analysis with him in relation with your objectives, your questionnaire, and outcome. So that one will be better. First one may not really have the time. Then on a lighter note, I want to advocate as the academician on project management. It's true. So most of these students are not really taught things on project management because most of their works are laboratory based. But for non-lab based, they need to have the skills. It means bringing somebody from outside that knows about this thing to maybe lecture the students in 400 level, from 300 or 400 level, to know how to go about project management. They have the confidence. But there was a time that some students, they came to UITH to do internship. Let me give one example. And two of them were assigned to me to supervise their projects during internship. And initially, when they brought their study, even one of them actually did projects, just went to drop one studies from somewhere. And I called them, I made correction, and I told her that this is what you are doing. She was shocked. Actually, the two of them ran away initially. Before they now came back, one of them now came back and was able to tell me that actually they did not teach them the school when they were in the school. And I had to put them through and the rest. The academic field, this project management should be taken into consideration that are not laboratory based. Let the student have skills in it. Thank you very much.
Thank you very much, Ma. Thank you very much for your contribution and the question as well. There was a question from Dr. Tricia, and I think somebody was trying to help out, but nevertheless, for the benefit of everybody, the question goes thus, that I am currently carrying out a CAP study on HCP, that is hospital, HCP on pharmacovigilance in my facility regarding sample size. Can the sample size formula you gave be used for such? I think that's another question from Dr. Tricia. Yes, I can see your hand, Dr. Williams. Dr. Williams, you have the floor. Dr. Williams.
Okay, can you hear me now?
Yes.
Good afternoon, everyone. I want to really appreciate Dr. Comfort Olurishe. You have done a very good job. The way you spoke is as if you have been teaching research methodology for a long time. It's very beautiful. Part of the comment has to do with teaching our students research methodology and biostatistics. University of Ilorin That is a 2-unit course for the first semester, preparing them as regards how they can carry out their research and even the analysis. Then with regards to the SMART objective you mentioned, the R there is not reliable, but realistic.
Realistic, sorry.
Yes, realistic. Then the prevalence, the one Dr. Amadu mentioned, in case there are no previous studies, there are no literature findings that show the proportion of the population that has this characteristic that you are looking for, you can use probability of 0.5. Since there are no previous study, you can do that. Then for studies, actually, your after the preconception, after the conceptualization, the next thing is thorough literature search. Why is that important? We do not want to reinvent the wheel. There's no need to duplicate effort. You find that without proper literature search, at the end of the data collection, you may be surprised that somebody has completed exactly what you have done, and all efforts will be wasted. And that literature search starts from the beginning to the end of when your publication goes out. Because after post-field, you will discover that something else may just pop out that you need to acknowledge in your work at discussion level. So literature search starts from the beginning to the end. These are my contributions for now. We want to really appreciate you. You have done a very good job. Thank you so much.
Thank you very much, Doctor, for that. Okay.
Hello?
Hello, sir. Hello, sir. You have the floor. Yeah, we are hearing you.
Yeah, can you hear me? Yeah, good afternoon, colleagues. Good afternoon, our great presenter in the person of Dr. Comfort Olurishe, and also the anchor person and all the participants. Mine is not a question, but I just want to commend the presenter. She's one of us from Amadu Bello University Teaching Hospital. In fact, she has raised points that the entire pharmacy profession that are interested in conducting research to really key into, so that we will be able to be publishing our own research works. What is happening in Amadu Bello Teaching Hospital, we really want to bring it into limelight, that our interns in training used to pass through a clinical research and a vigorous one that we have collaboration with all the medical teams, especially the medics, in conducting such researches, and also by going through the normal process of obtaining clinical ethical clearance. As such, I want to emphasize on this, that ethical clearance is very, very important. It's apt, so that your research will be publishable. That is my own contribution. Thank you, our presenter. Thank you, all the participants. Yeah. Thank you.
Dr. Mrs. Mustafa, I know you have been raising your hand too. You have one or two things to contribute.
Good afternoon, everyone. And
you
thank you
floor,
to
Let them on mute.
everyone for this insightful lecture. I just wanted to lend my voice to the contribution made by
Dr. Titus. Sorry, Dr. Mrs. Mustafa. Dr. Titus, okay, thank you. Okay, Dr. Mrs. Mustafa, you can go ahead.
Yes. Again, good afternoon, everyone, and thank you to the presenter for the insightful lecture. I wanted to lend my voice to the contribution made by Mrs. Medubi and then followed up by Dr. Williams. In truth, for universities, I'm sure it's embedded in the curriculum to teach students how to conduct research. Before any students will take up project research, they will have been taught the research methodology in one of the courses. And apart from that, at the University of Ilorin, we actually organize seminars and workshops to jumpstart the students when they want to take the project. Any student who, after he or she has graduated, moved into the hospital environment or other environment, and then is misrepresenting what the lecturers have done for them, is just I can't comment on that, because if students are running away or shying away, because I think the problem is stemmed from the fact that the thesis is tied to graduation. Meanwhile, in the hospital, I'm not sure there is anything, any punitive measure or reward for you to completing. If you give them something to do, are they held on to? Do you sign them off at the end of the program if they've not completed their research, or you just it's just to tick the box? If there's a premium price or something on people, okay, maybe if people do their research and they do it properly, maybe there is a competition, maybe at the end of the day, if you don't finish the research, you're not allowed to go. I'm sure they're going to put their all into it. Doing cutting and paste and plagiarizing is not a representation of any teaching from any university, because before you can pass your project off, then you would have done the jobs properly. I'm sure the lecturers are doing everything they can to mentor the students. It now behoves on the students to take the training and then push it forward when they become graduates. So I just want to emphasize that once, maybe for the training grounds, doing an internship is also another training ground. There must be something attached to completion of research allocated to interns. This would motivate them to complete the task before the end of their internship, and you won't have any case of runaway intern who has not completed his or her research. Thank you very much for giving me the podium to speak.
Thank you. Any other information I need?
I think you can unmute yourself. Hello, you can unmute yourself, Ibrahim. Okay.
Yeah, good afternoon. I want to thank the presenter for giving us this wonderful presentation. And this is my first time of joining this laudable initiation by University of Ilorin Teaching Hospital. I just want to add, based on what we are taught in our
I think the network.
Let him send the question.
From Ibrahim Yaya, can you send your question? The network
academia
is okay. Yes. Okay.
Improve
to respond to various comments, observations, and even questions from the contributors. Over to you, Doctor.
Okay. Thank you very much. I would like to appreciate everyone who has made observations and raised one or two issues. Especially, I would like to thank the lecturers from University of Ilorin, Faculty of Pharmacy. The first lecturer, I can't really remember her name, she actually has attempted to answer the questions on sample size determination. The second comment by Dr. Adekola, I would just like to say one or two things. I appreciate the fact that a number of universities do teach the students at undergraduate level research methodology. But I would like to state here that most times this is really just sufficient for the project work they need to carry out at that level. What we are discussing here is publishable research. I do not know how many undergraduate students really go ahead to publish their 500 level research work, because I think they are really lacking in the essential ingredients that are required for such. It's okay that they have the foundation, but when it comes to having to publish a research work, and the only experience you have is that enables you to carry out your 500 level project, I think if this cuts across universities, I think is inadequate. When you begin to carry out research that requires
fellows in West Africa,
publishing your research work. I think what we have at undergraduate level, I think is inadequate. If you see any research work published, it tells you that the supervisor of such research work has added a lot. He has made so much input because he is interested in publishing that work. It's not the students on its own that had the requisite knowledge and is able to bring that forth by himself. I don't appreciate the little that they are contributing. They bring it as a foundation, but it's something that we really need to work on at their internship level. It's not really adequate. Then also addressing the fact that during internship is a training. Yes, is a training. The research that they conduct as interns, for my own institution, we have research teams. I have published research work that my intern conducted as a supervisor, but it's something that I took up myself. I knew the ingredients I needed to put in place from the beginning of the execution to the post-execution phase. The whole write-up of the research for the publication, I did myself, because the student doesn't have the ability to put together what that journal requires. That's been very objective. I did it myself, and I published the research work. I've done that for some number of interns, and it's something we really encourage. The supervisors in my own institution are people that have postgraduate experience, both at the West African postgraduate college level and having undergone a master's or PhD program. That is why they are able to take up intense projects and have a concept and execute it to the level of being able to publish it. But leaving them from their requisite knowledge at undergraduate level, I think this is very, very insufficient. There was a question on knowledge, attitude, and practice on pharmacovigilance, whether that sample size formula can be used. Actually, there are a number of sample size determination formulas out there. Yes. I simply pick this because of the kind of study that we do in the hospital setting. This is what readily fits into it. There are different formulas, different names out there to determine your sample size. In fact, now there's even a free software that I mentioned. And I remember talking about the research you want to conduct, the type of research matters. The variables you are going to be looking at matters. The statistical tool you are also going to be employing, it matters. Even the G-power calculator employs all these at different levels to be able to give you a particular sample size. The one I brought to fore is using prevalence, for example. Now, there are other sample sizes that just use the entire population. Just give us the total number of population from which you want to pick a sample. There are formulas that use the whole population if you don't have the prevalence for the particular population on ground. I think these are the very few questions I can remember. Others were basically coming. Thank you.
Thank you very much, Doctor, for the wonderful response. Yes, if we are to take anything home today, the issue of training and retraining of our interns on the importance of research and the research methodology is very paramount in the hospital practice. Of course, I would like all of us to actually take a lead from this and definitely put it into practice. Without wasting our time has been fast spent, and I'll call on Dr. Mrs. Elegbede to give us a closing remark. Thank you.
Oh, vote of thanks.
Vote of thanks, yeah.
Okay, good afternoon, ladies and gentlemen. I'm Pharmacist Elegbede Busayo. My job is to give the vote of thanks. And I first and foremost want to appreciate the presenter of today, Dr. Comfort Olurishe. You have done a marvelous job and we really, really appreciate you. Thank you for the time that you have spared in preparing your slide and also for good delivery. May God continue to lift you up in the name of Jesus. We also want to appreciate Professor Reagba for being on the platform this afternoon. Dr. Mrs. Margaret Obono, the Director of Pharmaceutical Services, National Orthopedic Hospital, Igobi. Thank you, Mommy, for being on the platform. We also recognize pharmacist Fatima Bola Mustafa, WHO pharmacist retired. Thank you for coming this afternoon. We see some fellows of the Pharmaceutical Society of Nigeria. We recognize fellow Olanrewaju Alege, fellow Felicia Williams, and all other fellows of the PSM. We thank you so much for being on the platform this afternoon. We want to specially recognize fellows of the West African Postgraduate College of Pharmacists. I want to use Dr. Grace Merubi. She's the only one that I recognize, and all other fellows of WAPC. Thank you for making this meeting a very robust one this afternoon. I would want to especially appreciate Dr. Kola Mustafa. She's the representative of pharmacists in diaspora. She's always with us on the platform. Thank you, Ma, for joining us again today. We want to say thank you for the AHAP State Chairman, the CPAN Chairman States, the PSN Chairman States, and all pharmacists and friends of pharmacy profession who has deemed me fit to be on this platform this afternoon. Thank you so much for joining us. I want to especially appreciate the efforts of the Drug Information Unit of the Pharmacy Department, University of Ilorin Teaching Hospital, headed by pharmacist Ibrahim Kola Bello, for the good job that is being done here, and today for searching out seasoned presenters who are willing and very eager to share their knowledge with us in order to improve the practice of pharmacy profession. We also want to appreciate the head of department, pharmacist Rahman Afolabi, and the management of the University of Ilorin Teaching Hospital for providing a robust platform for us to grow as professionals. It is my prayer this afternoon that God will preserve all of us. He will protect us and sustain us till we meet again another time. Thank you all, and may God bless you.
Thank you very much. Please don't forget to leave your phone numbers and email address so that we can reach you as at when you. On behalf of the head of department of pharmacy, University of Ilorin Teaching Hospital, we therefore come to the end of this presentation. Thank you.
Okay, thank you, Dr. Comfort Olurishe, for that one. We thank all the participants. Next Tuesday is going to be another very interesting one. We all invite you. Thank you, and God bless you all. It's bye for now, and next time, yeah.